Okay, so today's webinar I've um, titled Back to the Basics. And so the reason for this is that we're going to go over some really basic things that I think we all need a refresher on, and hopefully will help with our QA scores moving forward. So I want to let you all know that we are going to get back on track with having regularly scheduled trainings. We don't have a schedule yet, but we'll be working on that and get a webinar schedule to all of you soon. What's going to be a little bit different this time around is that I'm going to start having short quizzes after the end of each training that will be delivered via SurveyMonkey. And for the most part will be multiple choice and will be less than 9 questions apiece. For moving forward, I'm not sure yet what all the topics are going to be for the remainder of the year. Part of it is probably going to be based on just need or things that come up. I do know with our contract with the Problem Gambling Helpline, we do have to provide one training per year about problem gambling. So there'll be at least one sometime before the end of the year about that. But if you have any topic that you would like to have some training on, feel free to email me and let me know. So I kind of already explained this a moment ago. There are several QA metrics that the center as a whole has really been missing the mark on. And you know, some of these basics are important not only to get the QA points, but also we want to make sure that you understand why some of these things are on the scorecard in the first place. So the first segment of today's webinar is going to be about the script. The script was crafted to ensure that if you use it, that you will get certain QA metrics. And for those of you that I've trained, I really have always hated to call the script a script because you know we're not working at Time Warner, and you know I've been kind of describing it as a loose guideline that you should use to help guide your calls. But since we have too many people that have too many different interpretations of what that should be or what that is, we are now going to make the script mandatory because we want to ensure good quality and also consistency with our calls. So we've updated the script. We've made a few minor tweaks that that you'll see throughout this webinar, but essentially the format of this is I'm going to go through each line of the script and talk about which QA metric that line is linked with and why it's important. And hopefully then we'll start seeing a bump in QA scores center-wide. So the first line of the script is the opening, which could be one of two things. If you're answering a call that's ringing, then you're going to greet the caller by saying, "Thank you for calling 211. This is," and then your name. "How may I help you?" Or if it's a call back, you will greet the caller by saying, "This is your call back from 211. Thank you for your patience. This is your name. How may I help you?" And the QA metric that correlates with this section of the script is used inappropriate greeting. The definition of that metric is specialist began speaking promptly upon connection, thanked the client for contacting 211 or other project, provided first name, and offered help. So why should I use a scripted greeting? The right type of immediate greeting can open up dialogue with the caller and also help them to feel at ease and willing to divulge important details about their circumstances and needs. And it also provides immediate confirmation of the service, so they know that they've reached 211 or the problem gambling helpline. They know the name of the person and they also know the name of the person that they're speaking with. And then just a reminder that AIRS standards require that we include all of these pieces in our greeting, that we thank the caller for calling, we use our program name, we use our own name, and we make some sort of offer to help. All right, so the next line is the beginning part of the assessment. Okay, you're looking for, and then fill in the blank. The QA metric that correlates with this part of the script is demonstrated active listening. And what we mean, the definition of that metric is the specialist listened to the client and through minimal encouragers, paraphrasing, and or questions and conversation, demonstrated a full understanding of the initial reason for the client's contact prior to asking the demographic questions. This metric would be partially met by using this part of the script because you'll have clarified what the client's need is, and you've done so before beginning to ask any sort of demographic questions. But it is still important to use minimal encouragers and paraphrase and ask questions throughout the course of the call. Oops. All right. So why should I demonstrate active listening? Active listening is a structured form of listening and response that focuses attention on the client and details of their situation, both spoken and unspoken. This technique helps make the client feel validated, listened to, and important. Active listening builds rapport that promotes mutual understanding and trust throughout the call. It also guides the specialist in deciding what assessment questions to pose, what kind of assistance to search for, what resources to offer, and when lacking resources, what types of alternative solutions might be welcome and appropriate. All right. So the next line in the script is I can check on that for you. And the QA metric that correlates with this is demonstrated a willingness to help. The definition of that metric is you've shown concern for the client by using statements that indicate a desire to help. So this portion of the script will partially satisfy that metric. So you do also need to avoid discouraging statements throughout the call and show concern for the caller and their situation throughout the call. All right. Why should I demonstrate a willingness to help? Demonstrating to a client that we are willing to help shows that we care about them and helps them to feel comfortable enough to open up about their situations and needs. All right, next line in the script, since programs serve different areas and ages, may I ask the zip code and the age of the person who needs the service? So the QA metric that correlates with this is explained reason and provided context for asking demographic and other questions. The definition of that metric is that you provided an accurate explanation for why any demographic or other assessment questions are being asked. So why should I explain why I'm asking demographic questions or other questions? Giving an accurate explanation of why 211 specialists ask certain demographic questions help our clients to understand 211's process and ensures that they don't feel that they are being interrogated or participating in a survey that's unrelated to the work of finding specific services to match their individual needs. Sorry, I had to mute myself there. I was coughing. I don't have the coronavirus. I'm just talking too much. Likewise, providing context around assessment questions helps build trust and rapport and can reinforce a client's confidence in and understanding of 211 service. So I want to just kind of pause right here and just say, you know, it's always important for us to explain why we're asking certain demographic questions, but I just want to put a big star and an exclamation point and everything else next to this. This is really especially important. It's a huge pet peeve of mine. Listening to problem gambling calls, and when we're not explaining why we're asking the veteran question, and the reason why it's particularly, I feel like it's particularly bad, is because that question sounds like it's coming way out in left field, I think, for most of our callers, because there's no sort of context or explanation as to why you would need to know if they're a veteran or not. So being sure to let them know that the reason that you're asking is because there's a high incidence, a high rate of problem gambling among veterans, and that there are specialized services available to them. I think your caller is going to be much more receptive to answering that question. Okay, so moving on to the next line in the script. Okay, that's 44146. Is that in Bedford or Bedford Heights? So the QA metric that relates to this is appropriately gathered customer demographic information. And the definition of that metric is asks and confirms zip code, age, and other pertinent information. For example, veteran status, insurance status, etc. That is required to perform an accurate and proper search. So why do I need to repeat back the zip code and verify the caller city? The demographic information that we collect can help us to find the most fitting resources for the person in need situation, and also performs an initial eligibility-based filtering of your search results. And because of this information's importance to the accurate search functionality of Refer, it's the expectation that all questions are asked on each call, except in cases where the client's mental or emotional state and or the severity or complexity or immediacy of the problem preempt the collection of any information that does not directly aid in addressing the caller's need. In such situations, asking unnecessary demographic information could damage the trust and rapport established between the client and the specialist, creating an incorrect perception that 211's primary concern is data gathering rather than one-on-one resource navigation. So In today's earlier session, Barry asked a question that kind of relates to this, and so I just thought it was a good question and wanted to address it here. So he asked, what do we do if your caller is getting very angry at you for the demographic questions that you're asking, and you're not able to de-escalate? In that circumstance, we don't want to further agitate or escalate the call. So it would be appropriate to go ahead and not ask any of the demographic questions that are ask any questions that aren't going to be completely necessary when providing the caller what they need. So if they're getting angry at you and you can't de-escalate, then it's okay to skip some of those questions. All right, so the next line is just thank you. And so the QA metric that this correlates with is was polite and courteous. Definition of that metric would be generally demonstrated basic conversational etiquette by using words and phrases such as may I, please, thank you, you're welcome, etc. You offer an apology for repeats and sought permission to gain more information. You use the client's name if provided, apologized properly, use the mute function to acknowledge or conceal accidental crosstalk with other employees or other distracting incidental sounds such as throat clearing, coughing, yawning, sneezing, and attempted conversation to put the client at ease. So why should I be polite and courteous? Being polite conveys respect, emphasizes our professionalism, creating a good impression for 211 and United Way, and it also makes clients feel properly cared for and comfortable with our ability to assist them, excuse me. All right, so this next part of the script, this is actually a little bit different, it's just slightly different than what we've used in the past. Now we will be asking the question in this manner. Sometimes there are additional services for those who've served in the military. Has anyone in the household served in the military? And the reason that we're tweaking this is it was on recommendation from some of our veteran connections in the community. Because some of those who have served are a little reluctant to call themselves veterans for a variety of reasons, and that can include, but is not necessarily limited to, length of time that they've served or their discharge status. And some of those folks may still be eligible for services. So we want to ask the question in a way that's not going to alienate anyone who might benefit from the Help to Veterans program. So that's the reason for the slight change here. And the QA metric that correlates with this is one that we already spoke about a few slides ago. Explained reason or provided context for asking demographic and other questions. So I already told you in a previous slide why we should do that, but just a repeat of that. All right, and then again, we're thanking them for letting us know if there is anyone in the home who has served in the military. So again, this correlates with the QA metric, was polite and courteous. All right, so the next line of the script, while I searched for that, I want to tell you about a program here at 211 that helps with accessing free or low-cost medications. Do you or does anyone in your household need assistance with the cost of prescription medications? So essentially what we're doing here is this was the point in the script where we used to ask, how did you most recently hear about 211? And we're not collecting that data anymore. So there's no need to ask that question. However, I think this is a good point to bring up the MedRefer program because you're doing so while you're beginning your search, so you're not forgetting to ask about it at the end of the call. Or I know a lot of times it's not necessarily that you forget to ask, but it's that the caller disconnects before you have the opportunity to ask this question at the end of the call. So I think hopefully a more effective place to move this question or statement, well, statement and a question, is right here kind of in this transitional part where we're beginning to run our search. I also, tried to craft this language so it very clearly explains what the MedRefer program does. During our calibrations, sometimes some of the descriptions that folks have been using for the MedRefer program really were kind of missing the mark. They weren't completely accurate, so this will, I think, do a good job of relaying to the caller what exactly MedRefer is. Okay, so why do I need to ask this question in this way? So giving an accurate explanation of why 211 specialists ask certain demographic questions help clients to understand 211's process and ensure that they don't feel that they are being interrogated or participating in a survey that is unrelated to the work of finding specific services to match their individual needs. Likewise, providing context around assessment questions helps to build trust and rapport and can reinforce a client's confidence in and understanding of 211 services. We want to make sure that we're accurately describing the MedRefer program. Even if the caller doesn't need assistance with prescription medication, they might have a friend or relative or neighbor who could benefit from the program. And we really want to advertise MedRefer in an accurate way and in a positive light. All right. So the next line in the script is, I found a program that may work. And the QA metric that correlates with this is remains non-judgmental, avoided personal opinions, advice, religious or political statements. And the definition of that metric is avoided offering advice, judgmental statements, and personal opinion or disclosure. Maintained objectivity regarding both the client's situation and the referrals provided. So, of course, this statement doesn't fully satisfy that metric, but it does partially satisfy it. You are essentially you're introducing information for your client's consideration and not telling them what they should do. So why shouldn't I tell a client what they should do? So an important AIRS standard and a basic concept of community navigation is to be non-judgmental. And this allows us to recognize a client's right to self-determination, to judge for themselves based on their own values. And this means that the client has the right to decide what to do about their own situation. By refraining from giving advice and expressing personal opinions, we're allowing the client to decide for themselves on how to handle their situation. All right. Next line in the script, do you have a pen and paper to take down the information? That's okay, I can wait a moment, or I can send it to you in an email or text. Thank you. So the QA metric that this correlates with is used appropriate tone, pace, volume, and inflection throughout the contact. The definition of that metric is you remained welcoming, friendly, and personable. When necessary, adapted your tone and pace to either match, complement, or de-escalate the client's tone and pace. And if necessary, employed strategies to focus or refocus client on needs and resources, and or maintain control of the conversation or contact. And of course, this doesn't fully satisfy the metric, however, it partially satisfies it as you are making sure that you are not providing information too quickly for your client to take it down. Why do I need to make sure that the caller is ready to take down the information I am providing them? Using an appropriate pace for the conversation, which should be set by the client, allows the client to feel like they're in control and gives them time to consider options presented. It also reduces unnecessary callbacks because the caller missed important details. Okay. So the next line in the script, if it's an unmet need, I want to explore all avenues that could possibly be helpful. Could you tell me a little more about the situation and what happened? And then at that point, you're going to search for resources to address the underlying cause and do some problem solving with the caller. So the QA metric that this correlates with is attempted to establish dialogue and asked correct questions to determine client needs. The definition of that is the specialist continued using active listening techniques and critical thinking skills throughout the contact to acknowledge the client's entire situation by asking open-ended and close-ended questions to probe for more information. Specialist recognized, clarified, and addressed any stated or unstated additional needs revealed in the course of the assessment, conversation, or on a phone call through audible environmental cues such as the client having trouble breathing or a child is crying in the background. So why should I probe to find out more about my client's situation? There may be other factors about their situation that they did not initially disclose that may impact their ability to receive assistance for their stated need. And also, approximately a third of our callers have needs in multiple categories. And so just an example, your caller might not be eligible for a rent payment assistance program, but they might also need help with their medications. And perhaps if they may be able to pay their rent, if they can get some financial assistance for their medications. All right. So next line in the script, this is post-referral. You are going to first summarize next steps for the caller, and then say, do you feel you have enough information to get started? Great. Is there any other service that I can help you with today? And the QA metric that correlates with this is client has a clear plan to move forward. And the definition of this is after providing referrals and prior to ending the calls, you walk the client through a chronological step-by-step summary of the plan that you created together. And you confirmed that the client feels that they have enough information to undertake that plan. So why does my caller need a clear plan to move forward? The process of assessment, need identification, and resource referral is often complex, spanning multiple requests, needs, agencies, and services. It's easy to forget that when a client gets off the phone, they will have to take all of that multifarious information and put it into use as you either pick up the phone again or get on the bus or go online. And it's vital that in addition to getting a client the information that they need, that you should also work with them to ensure that they're comfortable using that information and have an ordered, prioritized approach for contacting agencies, applying for programs, and resolving their problem without further unnecessary frustration or duress. All right. So this is a line you won't use too terribly often because we don't do a whole heck of a lot of follow-ups. But in the cases where you feel it is appropriate and it meets the our follow-up policy, then what you will do is use the following statement or question, may I or may someone call you back to see how you're doing and if your needs were met. If the call goes to voicemail or if someone else answers, is it okay to leave a message? And the QA metric that this would satisfy is offer to follow up with the client if applicable, recognized when follow-up is needed based on the 211 follow-up policy, gathered callback information, and established an estimated time of return call. So why should I offer a follow-up? Following up with a caller in crisis or with a complex need is important in community resource navigation so that we can make sure that the clients ultimately receive the services that they are pursuing. Follow-ups may also provide an opportunity to provide advocacy on behalf of the client or reveal changes to the social service landscape that require investigation by the resource department. Follow-up is also the best and usually the only way to construct any quantifiable measure of 211 success at providing clients with accurate, usable information. Okay, so then that brings us to the closing. And that is, thank you for calling 211. If you need further assistance or if this information does not work out, please call us back. We're here 24 hours a day. And the QA metric that satisfies is used appropriate closing. The definition of that metric is used the script with offer of further assistance, encouraged client to contact 211 or other project again if referral does not work out, thanked client for contacting 211 or other project, and where scripted closing is not appropriate, a customized closing based on the outcome of the contact. So why do I need to use the scripted closing? It prepares the caller for the ending of the call, ensures that nothing has been left out, and reminds the caller to contact 211 or other project again if the referrals do not work out, or if they have another related or unrelated need. Thanks client for calling 211 or other project to show that we appreciate their business. A good closing ensures that nothing has been left out and that the client is comfortable with ending the call. Client is encouraged to call back if referrals do not work out and reminded that they can call 211 or other project again if they need further assistance. This reinforces the service's constant availability, leaves clients with an impression of professionalism, and brands our program name. Our script was actually crafted to meet AERS standards. So that's why it is worded the way that it is. So before I move on into the next segment of the webinar, does anybody have any questions about the new script?
Molly?
Yes.
Are we going to get copies of it so that we can, have it posted at our desk?
Mm-hmm. Yeah.
Okay.
I'll be emailing it out
Okay.
after the conclusion of this webinar. I'm going to print out copies for those of you who are in the office, and then when Matt Finley returns from vacation, he's going to be uploading it into Refer.
Okay.
We did some tweaks, and he uploaded a recent copy into Refer, but then since he's been on vacation, we made the tweak with the veterans question. So we're going to have that updated and have him put that into Refer, so you'll have access to it there as well.
Okay. And one more question, if you don't mind.
Mm-hmm.
A lot of times people are in a hurry and they don't want, and I mean, I understand about how you end and, to be polite and reiterate our purpose, but
Sure.
they just want to get off the phone. So all of a sudden, goodbye, that's it.
If somebody, just a reminder that for certain QA metrics, you can score an NA, not applicable,
Okay.
which means that you're not getting the point, but you're also not getting penalized. So if the
Okay.
caller just abruptly hangs up before you can do the closing, then you'll get an NA on that metric.
Okay. Okay.
Yep.
Thanks.
Yep. Okay, so the next segment of today's webinar is really the whole reason why I asked you all to email me your little 211 elevator speech. And so, sometimes folks will ask us either on the phone or at outreach events, or even just people that we meet outside of work will ask us, what is 211? And as 211 staff members, we really need to be our own best marketers, advertisers, and cheerleaders. And so, we need to remember that, we are all professionals, and the jobs that we do are really important, and they impact people in a positive way every day. So, during some of the calibrations, we've heard on a number of occasions folks explaining 211 in really not the best way or the most positive way. And so we really want to highlight today how to talk about our service. So I selected a few of the elevator speeches that were sent to me, and I want to highlight the ones that I thought were the best, and kind of tell you why I liked them. So the first one was submitted by Barry, and Barry says, 211 is a 24/7 service of the United Way, and we provide information and resources to help anyone who calls after assessing what situation that they are in. We have a resource department that is constantly updating the resources we provide so that we can give the caller accurate and up-to-the-minute resources to help them with any need that they present us with. So there's a few things that I really liked about the way that Barry describes 211. I like that he right away says or highlights the fact that we're doing an assessment. So we can provide information after doing an assessment. And then I also really like how he highlights the importance also of our resource team and our database. So, we are not just Googling stuff and providing outdated misinformation that we found on the internet. Like, we have an entire department that is updating the information and making sure that what we're providing to our callers is accurate. All right. The next one is from Judy, and Judy apparently was taking a elevator ride that was like all the way to the top of the Empire State Building because it is a little long, but I still thought it was really good because she had a lot of points in here that that I think really highlight the importance of what we do here. So Judy says, 211 is a 24-hour number to find out about all kinds of health, social services, and government programs that may be able to help you. You will talk to a specialist who will ask questions to determine what kinds of help that you want and need. Then we will let you know what places may be able to provide that help, give you a lot of information about the specific services that they are interested in, and let you know how to contact these programs. So, in a nutshell, 211 talks with you to determine what your situation is and what services may be able to help and how you can get connected with these sources of help. And all of this is free just by calling 211 24 hours a day. So again, similar to Barry's elevator speech, Judy highlighted that essentially the assessment piece. So we're going to ask questions, and we're going to help you determine what kind of help that you want and need, and come up with some detailed information on how to access those services. All right, so the next one was submitted by Suzanne Yarborough. And Suzanne says, 211 is a link to health and human services in our community. Many people call us for a variety of assistance. Sometimes a food pantry, shelter, healthcare services, just to name a few. Sometimes people call for help and they aren't sure what they need. With each call, we help assess their situation and put them in contact with agencies listed in our community resource database to help them with their current needs. So again, and you'll see a common thread with all of these, that Suzanne talks about doing an assessment. We assess the situation. And one of the things that was unique about Suzanne's elevator speech, which is just so true, is that sometimes people call us and they don't even know what they need. They're not sure. They need to kind of talk it out with us, and have us help them to assess what's going on and help them to put together a plan. So there we go. And then I have one more. This was submitted by Nikki. And Nikki says, 211 is a 24-hour, 7-day-a-week confidential information and referral service. Many counties across the country have a 211 service. Our goal is to link clients in need of resources to the appropriate community agencies. These may include food pantries, utility help, or rent. However, our job is to have a conversation with the client to determine their individual needs, and we're always here to help. So again, as you notice, like every single one of these highlights the importance of the assessment that you're doing. What I also liked about Nikki's is she does mention that 211 isn't something that's just unique to our area. It's something that's available in many places across the U.S. Okay, so just a few tips about talking about 211. When we've done some calibrations, we've overheard, not overheard, but we've heard a few specialists use some kind of negative language when talking about our service. And what I mean by that is just some examples here. We don't provide direct service, or we just provide referrals. We're only a referral agency. And we really want to avoid that kind of negative language and really focus on what we can do versus what we can't do. So some things to keep in mind is that 211 is staffed by professionals with a background in social services. We assess individual situations. We help our clients create a plan, and our resource team ensures that the information in our database is accurate and is up to date. And then one more tip. If you can't remember anything that I've just talked about when you're on a call with someone, just pull up the service description in Refer. So the service description in Refer reads, offers confidential assistance with meeting health and human service needs in Cuyahoga County. A 211 community resource navigation specialist will talk with the client, assess their situation, identify and explain potential resources within the local network of agencies, programs, and services available to help, and then work with the client to develop an individualized plan based on the client's particular need or situation. The specialist may provide information about a range of services, including food, shelter, healthcare, substance abuse, mental health, recreation, and social activities. The specialist will also attempt to provide extra guidance and problem solving as needed, identifying potential barriers to accessing service, and, if necessary, following up with the client to check on their progress. So does anybody have any questions about describing 211 or our elevator speeches?
This is Darlene. I have a quick question with that elevator speech.
Oh, sure.
That's not part of our script, correct? You're just asking us if we were to tell someone.
Yeah.
Generally, that's what we're trying to get across, correct?
Yeah. So it's not
Okay.
part of the script, but we just want to make sure that, I know that sometimes folks will call and they're like, I don't even know what 211 is, but somebody told me to call this number. That we are explaining what we do in a way that's very positive and really highlights all of our strengths and all of the things that we can do for people. So that was kind of the whole purpose of the elevator speech.
Okay, thank you.
Okay. Yep. So now, oh yeah, go ahead.
Okay. Just we're in, when you say it's in Refer and Matt's going to add something to Refer for things that we would use for our purposes to review, where do we access that on the database?
You mean for the script?
Well,
for the
no,
updated
just
script?
some of the things you said when Matt comes back, he's going to add to Refer, and then you just said in Refer, and then you showed us that, and I just looked up,
So
and Standby, and I didn't see anything where to see that in Refer in our records.
Okay, so as far as the script, that'll be in the contact markers. So right now it is. Where do we go?
Oh, okay, right.
Yeah,
Okay.
where is it? Oh, is it in the tip sheets? Okay, the script. So this is just slightly out of date. We have to put the newest one.
That's what I was wondering.
In there. So the script is right there. But
Mhm.
I'll also provide you with a paper copy, and I'm going to email everybody the script as well, so that you have it. And then. Okay, so if you look up comprehensive information and referral, our program comes up here, and that snapshot, that screenshot that I had embedded into that slide, it's coming from right here. So it's right in here. You put in a Cuyahoga County zip code and search, do a taxonomy search for comprehensive information and referral.
That's right. Okay. All right. Thanks. I find it after you were started. I found it.
Okay.
Thank you.
Okay. All right. So we're
Molly,
gonna.
can
Yes.
I'm sorry. From Barry and Suzanne and Nikki, can you send us those two? Those are really good. They're good tips to keep in mind.
Yeah. Sure.
Can we get? Okay. Thank you.
Yeah. I'll make the slides of the PowerPoint available.
Okay. Thanks.
Okay. All right. Okay. So so now we are in the final stretch of the final third of the webinar today, and we're going to talk about some just some quick updates on a whole bunch of different topics. So first one is in regards to the Aging and Disability Resource Network, also more commonly referred to as ADRN. And soon you are no longer going to have to answer that line. So hooray for that. We've been answering that line for years and years and years without even having a contract for it or getting compensated for it in any way. So this is not it's not a newly lost contract, so it's nothing to worry about. So what's going to happen when people call that ADRN number, they are going to reach an IVR that asks what area that they're in. And then the caller will select the option for their area, and then the call will then be transferred to their local Aging and Disability Resource Center. So I don't know the exact date when that transition is going to happen, but it is going to be relatively soon. And we will let you know once that has been done. All right. So there has been a delay with getting the contract signed and publicly filed for the Cleveland Department of Public Health. So we did not launch it on 2/11 as planned, but it will be launched really soon, and you will be notified by email of the official start date. So I am not sure at this point if if everything happening with the coronavirus is going to speed that up or slow that down, but or affect that getting started in any way. But I know that that they are very very much so looking forward to us taking that burden off their hands. Okay. Next thing I want to talk about is our technical policy. And so what I mean by that, like putting yourself in a technical state in contact. And this really is more addressing those that are working remotely. Because generally, if you're in a technical state in the office, there is some member of the management team or IT available to help you out. So if you are having technical issues that you are unable to resolve on your own within 5 minutes or less, then you must call the supervisor line. So we all know that we can all do a little bit of troubleshooting on our own. Sometimes it's as simple as closing out of an application and then reopening it. In those sorts of situations, you don't need to notify the supervisor. However, if you're in technical for more than 5 minutes, then you do need to call the supervisor line. If you're working remotely and you are in a technical state for more than 1 hour, then you're going to need to log off. You can log back in once a supervisor or IT staff member is able to assist you. All right. So after that 1 hour time span, you have the following options. So either first one, you can come into the office. However, the office is only open Monday through Friday, 7:30 a.m. to 6 p.m. So this is really only applicable for those of you who work at home during daytime hours. If your technical issue is related to a power or internet outage, then you can go to an alternative location as long as it meets the requirements outlined in the work at home policy. And if you utilize this option, you're not going to be compensated for travel time. All right. If neither of these options apply, if neither of those first two options apply, and you have PTO, then you are required to use PTO for the portion of your shift that you did not work. Or if you do not have PTO, then you will not be paid for the portion of your shift that you did not work. All right. So next thing, chat training. The Ohio Department of Mental Health and Addiction Services, there are funders for the Problem Gambling Helpline. They have asked that we extend our problem gambling chat to 24/7. And so tentatively, we would like to go 24/7 with problem gambling chat on April 1st. And then after we see how extending to 24/7 chat goes for problem gambling, then we want to move to offering 211 chat to 24/7 as well. We don't have an expected launch date for expanding chat to 24/7. So we're just going to kind of get the problem gambling chat going first and see how that goes, and then we'll phase in the 211 chat at a later time. And we're going to be working on getting everyone trained on chat this month. So you guys are going to get all sorts of training happening during March. So we've updated the QA metrics for chat. So Candy, Matt Finley, and I worked together to update those metrics because some of them don't quite correlate to handling chats. So these updates, I've recorded a webinar and uploaded it into Degreed. I know actually a few of you have already watched it, so that's great. So all navigation specialists will need to view the QA metrics for chat video. After that point, navigation specialists who have not done chat before are going to watch a chat tutorial in InContact University. And I'm going to show you, I'm going to pause in my talking about these slides for a moment and just very briefly show you, and don't worry, I know I'm going to be going a little bit fast here. We're going to provide you with instructions on how to access this. But I just want to show you too, just so you can at least see what it's going to look like when you log in. So you're going to be going to university.incontact.com. And in order to log in, you're going to use your username for InContact, which is just your United Way email address, and then your password for InContact. All right. So once you're logged in, you're going to go towards the top of the screen in the center where it says courses, and we're going to select that. And then the course number is 1621. All right, 1621 is for ACD Max Agent. So some of you may have just recently taken a look at this. I'm going to click on, since I've been in this course before, it says retake course. For those who haven't been in it before, it's just going to say take course. And it'll load up here. And I'm going to click Start. And then you'll see a menu on the left-hand side of your screen. And most of these things are either stuff that you already know how to do or things that we don't use at all. So you're just going to scroll all the way down through this. And at the very bottom is the chat section. And so you're going to go through accept the chat, quick replies, concurrent chats, and try it chat. You don't need to do the omni-channel, and you don't need to do transfer or commitment, because those are features that we don't use. So it's accept the chat, quick replies, concurrent chats, and then try it out. It's a really brief training, and you'll have time to review each section more than once if you need to. So once you complete that, then you will have some one-on-one practice time. Those of you that work during the day, you'll be practicing one-on-one with Candy. And for those of you who primarily work evenings and weekends, are going to work one-on-one with me. And so I'm anticipating during the last full week of the month, and then the following couple of days, the 30th and 31st, I will be working remotely from home during evenings and weekends, so that I can catch up with all of you folks that work during those shifts and make sure that you're all comfortable with chatting before we go live. All right. We're going to start QAing chats on April 1st. And initially, this is only going to be for providing you with feedback and coaching, and it is not going to impact your objectives and key results or OKRs. And then also during this time, we might end up tweaking the QA metrics if we see that it's necessary. You know, Matt, Candy, and I worked on this, and we you know, had our best. You know, we did our best with kind of figuring out what we think they need to be and how they need to be scored. But you know, maybe once we're actually starting to QA things, we may see that there's something that we didn't get quite right. So we may have to do some changes. So we'll see if we need to do that once we start QAing. And then we'll definitely let you know once your QA chats will begin impacting your OKRs. So you'll all be kept in the loop on that. We won't just spring it on you. All right. So the next thing is smoking cessation. So just a reminder that for all of your smoking cessation referrals, we are now offering callers the opportunity to participate in a research study regarding the effectiveness of the referrals that we provide and also their experience with 211. And so what you would do is go to the contact markers, select the smoking cessation checkbox, fill out the form, and then email it to 211supervisor@unitedwaycleveland.org. And just a reminder that participants will be compensated in the form of a $25 gift card. So we learned from Smoke-Free Homes that folks generally don't want to participate unless they get compensated in some kind of way. So so we want to make sure that we are letting them know that if they choose to do this, that they'll be compensated. Otherwise, I project that the amount of people that would want to opt into this would be very close to zero. All right. right, and then the very last thing on the agenda today is talking about the coronavirus. Um, I want to start out by saying that this is a rapidly changing situation, and so things might change as far as how we're handling these calls or what information that we're relaying. So it's really, really critically important for everybody to be checking their email throughout the day for any messages from 211 updates. And also making sure that you are thoroughly reading refer every time that you make any sort of referral related to the coronavirus, because changes will happen. We expect that there will be things that evolve as this virus spreads. So what I did in this slide, this is just exactly copy and pasted directly from the email that we got from 211 Updates a few days ago. So the primary resource currently in the database to refer clients who have questions or concerns about coronavirus is the Ohio Department of Health Service Group Coronavirus/COVID-19 Information, COVID-19 Information Line. The description states, provides general information, rumor control, and updates about the coronavirus, also known as COVID-19. Staff can answer questions about the disease, how it's spread, and its prevention. If staff determine that there is a high probability that the caller may have contracted the coronavirus, they will instruct them on what steps to take next. Line is staffed by public health officials. And you can find this resource using the taxonomy term disease/disability information with a target to the coronavirus. As it states in the unpublished note of that resource, any calls including any sort of concerns about the coronavirus should be recorded as a disaster call. Make sure that you're recording it as such. We have had representatives from 211. Matt Trahan has been our primary contact point at the Emergency Operations Center and has been part of the what they're calling the Joint Information Center, or the JIC, regarding the coronavirus. There are representatives in this Joint Information Center from various entities throughout Cuyahoga County. We've got the Cuyahoga County Health Department, the Cleveland Health Department, the Mayor's Office, the different hospitals, representatives from different police and fire stations, the RTA police, and then, of course, 211. And the purpose of this is to make sure that all of these different public entities are providing consistent information about the coronavirus. So we're all giving a unified message to the community to build trust, and also to try to do some rumor control as well. We are, Frank and Matt are both there today, and just getting updates from all of these different organizations about things that they're seeing, and also all of these different organizations are sharing any sort of concerns that they have about their ability to provide services. So hopefully that the group can come up with some solutions on how to respond or how to handle some challenges that they may face. So again, at this time, we are only referring to the Ohio Department of Health. However, that may change, and it may change quickly. So just please, keep reading your emails, keep reading refer, and we'll let you know. One other thing regarding the coronavirus that I wanted to mention, I think maybe, Tom, did you participate in Flu on Call? I think you're the only one on the phone that might, or on this, that may have done that. Did you do that one year?
Yes, I did. That was 2-3 years ago.
Yeah. So I wanted to address Flu on Call. So I was on a webinar yesterday put on by AIRS, and for those of you that, well, let me backtrack. For those of you who don't know, so Flu on Call is a program that's a partnership with it's primarily run by the CDC, but in partnership with certain 211s and United Way Worldwide, as well as some medical information lines that include some poison control centers and some other medical information lines. And the purpose of Flu on Call is for when there is a pandemic flu and the CDC needs to have a way to get information out about the flu prevention, any sort of treatments out to the community. And what happens, what is likely going to happen first is they will operate a sort of Flu on Call, but it will be online and self-directed. So folks will go to a website and look up the information that they are seeking regarding the coronavirus. So it will likely begin in that way. And then, if needed, then they may call. They may activate a phone number that folks will call, and that certain 211s, not all 211s, but certain 211s that are partners in this program will then handle those calls that are coming in using a script to answer any sort of questions regarding the flu virus, and then escalating any callers who are actually sick or who are caring for somebody who's sick to a medical professional that is is better qualified to answer those kinds of questions. So right now we're kind of like, we would not be one of the first 211s to take those calls. We were kind of like the backup crew. So that's something that may or may not happen. Right now, I wouldn't worry about it just yet, because they may end up not even needing us. But I just kind of wanted to keep you in the loop, because I knew at least a few of you have been here when we've done the Flu on Call simulations in the past. So I knew that would be a question, or at least something that some of you might be thinking about. So that's
similar to Ebola, Molly. Mm-hmm. When we had the Ebola issue, they trained just a few people to take those calls in case it was needed.
Yeah. So there's going to be, with this, we expect that there's going to be some different things that we may be asked to do. So if resources regarding this become available, of course they'll be added to refer. We may be asked by the health department to take on a bigger role and handling some calls with questions, but we will make sure that everybody is comfortable with answering those questions, and and that you have all the tools that you need right in Refer, so that we're doing a good job with helping with the rumor control. That's kind of like the most important thing that we can do is get out information about resources available, and also help with rumor control, and then to triage or escalate any calls that are beyond our ability to help. Okay. So that's it. That's all I got for you guys. Does anybody have any questions, concerns? Have a joke to tell me? Anything?
I wish.
Yeah.
All right. Okay. Well, if you think of anything, any questions, just go ahead and shoot me an email. And thanks everybody for joining me today. And have a good rest of your Thursday.
Oh, thanks,
Thank you.
Molly.
All right. Bye, everybody.
Thank you, Molly.
Bye.
Thank you.